Dr. Rachel Loftin is a clinical psychologist who specializes in social communication challenges, such as autism spectrum disorder. Her practice is focused on the diagnosis, assessment, and treatment of children, adolescents, and adults. Dr. Loftin's clinical research interests include increasing skills for general physicians to treat people with autism spectrum disorder, violence risk assessment, and sexuality education for people with social challenges. Dr. Loftin maintains a private practice that offers diagnosis and assessment, therapy, and consultation on educational and legal cases. She's on the editorial board of the Journal of Autism and Developmental Disorders and is an adjunct faculty in the psychiatry departments in the schools of medicine for Northwestern and Yale University. For the next 45 minutes, Dr. Rachel Loftin will talk about promoting healthy relationships and sexuality in autism spectrum disorder. We are so delighted to have Rachel with us today, and she is going to share some really important information about something that I think is a really important topic. As a clinician myself, I find myself having these conversations with patients and families all the time. And in fact, it's a conversation that I think is often ignored. And sometimes we might neglect to have it either as a professional or even within our own families. And so I'm so glad that Rachel's here to talk to us about this, help us remember that as human beings, we all have questions and curiosities about other human beings. And so Rachel, I'm going to turn it over to you so that we can all learn about this important topic. So welcome, and we're glad you're here.
Thanks, Kristen. I'm glad you asked me to come.
Yes.
Going to take just a minute here to get my screen share going. Great. Okay. So really eager to talk with everybody today. Thankfully, Kristen did the longer intro, so you got a lot more information about my background and where I'm coming from, but I normally start off talks like this by talking about my background a little bit because it's relevant in that I see the whole range of situations that can come up related to relationships and sexuality. So certainly I see a lot of therapy patients who are kind of garden variety situations that come up, people who want to have a boyfriend or a girlfriend or just don't have the complete sex education that they need. So some common things like that come up. But in addition, I see a lot of people who have more complex needs and have gotten themselves into much more difficult situations. And so I'm going to kind of draw on both frames of experience here. So the people who are just like most students on the spectrum who need a little extra support and encouragement in learning about these things, as well as those people who might have more significant problems in this area and might really struggle to express themselves in ways that are socially allowed and appropriate. There we go. Okay. So what I'm going to cover today, I'm going to start by talking about healthy sexuality and relationships in autism. And I want to focus in particular on the internet because that's where a lot of difficulties come up. And also because that's just the world that most people are living in right now. Most people are spending a great deal of time online. So I think it's quite relevant to talk about. There we go. I'm also going to hope that we can get through some of the barriers that can come up and really discuss what those barriers look like. And I like doing that in a ecological framework. So we're going to talk about the different levels of risk and the ways that interactions happen, but not just risk, also promoting quality of life and positive relationships and positive interactions. So I'm going to try to always come back to that positive aspect. I think so many of us get scared or overwhelmed or confused when these topics come up, and I want to make sure that we maintain our focus on quality of life, which means enhancing relationships, improving communication between people, and making sure that people are enjoying their life and getting what they want out of it. And that does relate to relationships and sexuality, as well as lots of other domains. Okay, and then the next slide here. Okay. So the question of what do we know about sexuality and autism has evolved significantly over time. When I first started presenting on this topic several years ago, we would say, well, there's not a lot of research. What there is really old and outdated and, not done very well. It's kind of a hodgepodge and a mess. However, now what we tend to report is that there's a lot coming out. It's a really exciting time in sexuality research and autism. There are still more questions than answers, and a lot is still unknown about what we can do to support people with autism and their sexuality, but also just how does sexuality, gender expression present in autism? In part, this is a difficult question because of the heterogeneity of the spectrum. As I'm sure everyone here knows, if you've met one person with autism, you might kind of know that person, but that's about it. There's so much complexity that you have to know a breadth in order to understand anything about it. So that really can get in the way of us fully appreciating and understanding differences that may be there. And as I mentioned earlier, there's a lot of difficulty with older studies, and some of them did some real damage, promoted some myths and gave unhelpful information. And so we're still kind of repairing that damage and working to get back to a place that can be helpful and useful for people. Okay. One thing we do know is that most autistic people do want intimate relationships. Yes, asexuality is a real thing. It's not known what percentage of the population that truly impacts an autism. It's thought to be a pretty low percentage, but most people want intimate relationships. There's a lot of diversity in sexual orientation, and some of the more recent studies seem to suggest that there might be a bit more diversity in autism than there is in the general population when it comes to sexual orientation. Some of the most recent studies suggest that is particularly true among women on the spectrum, even more so than men. Also, the more recent studies are suggesting that there are more gender dysmorphic traits in autism than in the general population. And what gender dysphoric traits means, I said dysmorphic, I meant dysphoric. What that means is people who feel like they're assigned gender, so the gender given at birth, which is normally based on genitalia, that assigned gender doesn't feel like it's right in some way. And so people who have gender dysphoria seek out something like a change in pronouns and their name. Possibly, they may seek out medical interventions that affirm their gender. They may seek out being treated like a person of that gender that they believe they are. And they may seek out clothing or other cues to other people that signal the gender that they are. And we call those things gender affirming interventions because they're steps that a person takes to affirm the gender that they identify with. However, we know that identity in autism can be really difficult to establish, and that having a positive autistic identity seems to be pretty important to understanding one's sexual orientation and understanding one's gender expression. Lately, I've had a lot of referrals from parents who want to talk to me about their child's gender expression. And sometimes they express a concern that the child might be doing something or saying something about wanting to change gender just because their friends are doing it or just because they read something online. And I want to say here that I think it's important, first of all, to listen to parents and understand where they're coming from, but even more importantly, to encourage caution about how parents talk to kids about their identity. It's really important, as we all know, in autistic people to support their self-advocacy and to support their independence. And I think sometimes the message can be given to an autistic person that they don't really know anything about themselves, or they don't know what they want, or they don't know what they believe. And that can really undermine one's identity. That can really undermine self-advocacy efforts. So Of course, it's important to be cautious about medical treatments and medical affirmations of gender expression because they can be difficult to reverse or they may have side effects. However, there's no reason that people shouldn't call autistic adults who are, or even adolescents who are expressing gender differences by whatever they want to be called. And that just shows that you're respecting who they are, and it can really help the parent-child relationship. I think when I see parents who try to fight the point of a name or clothing or some of these expressions with a child, it can really damage that parent-child relationship in a way that's extremely difficult to repair. So just wanted to make that caution there. Okay, so this is where I want to talk a little bit about sexuality education and what kind of sex ed autistic people receive. I have a little Woody Allen joke, which I get is completely inappropriate for a talk about appropriate sexual behavior. But there's the line from Annie Hall about the food is terrible and the portions are so small. And that's essentially what happens in sex ed. For the most part, it's not good, it's not comprehensive, it's not delivered well. And typically kids, even kids who don't have autism, aren't getting enough of it. So I'll talk more in a second about the formal sources of sex ed, but informally, sources are things like media, social media, peers, and those are significant problems as well. Most people learn a lot about sexuality and what's okay and what's not okay from their peers and from their friends. For people with autism, that can be very difficult if they don't have as many friendships and peer relationships, or if their peers are just as confused about sexuality and relationships as they are. So the lack of peer connections can really interfere with acquiring sex education knowledge. Speaking specifically about formal sex education, here are a few of the things that can be problematic. Typically, the curricula that are used were designed for general education students. They were designed without full consideration of the social needs and communication needs that we know are unique to autism. It also can often assume a lot of prior knowledge, and it is often surprising to educators and clinicians when they hear how many things a person doesn't know. And you can't assume that prior knowledge in an autistic student. You need to go back and really establish that all of those bases are covered and that there's very comprehensive and complete education, because one or two gaps in the education can lead to pretty significant confusion or problems down the road. Sometimes there's misinformation that a person has acquired over time, a misunderstanding or something that doesn't get corrected, because if there isn't more of that direct interaction and time taken to talk about these things, that misinformation never comes to light. So a teacher or a parent never gets a chance to correct that misinformation that might be there. Additionally, in the instruction, we know that it's easy for students with autism to miss the main point or the main idea if it isn't made very explicit to them. And that may very well be the case in sexuality education, where it can appear that the main points are don't get a sexually transmitted infection and don't get anybody pregnant, or don't get pregnant yourself before you're married. But there's a lot of other information that is also very critical that can get missed. So what we have here is a depiction of kind of a simplified social ecological model. And this is a way to think about the dynamic interrelations among different systems. And I want to use this to depict how a person and their context interact to create a positive or negative environment for learning about relationships and sexuality, as well as developing opportunities for relationships. And so you can see in the concentric circles that the middle is the person, the next one out is their family, and we can include friends and other close people in that. And then we have the broader society. So when we look at the individual level, what are some of the things that can come up for a person with autism that could interfere with sex ed, or it could interfere with relationship development. Pretty significant one, a very common one, as we know in autism, is psychiatric comorbidity. So if you have significant inattention, or you have significant anxiety, or you have depression, of course, all of those things can interfere both with your ability to attend and take on the instruction you're given, but also with your ability to interact with others. So that's a pretty significant one. Of course, the core features of autism, such as, communication difficulties. If you have significant pragmatic language difficulties, it's going to be hard to pick up on some of the social cues related to dating, related to intimate relationships. Social cognitive deficits, of course, are extremely important. And what I mean by social cognitive deficits, what are the thinking aspects of understanding social relationships? So often this includes perspective taking. If you have difficulty appreciating another person's point of view and guessing or making hypotheses about how another person feels, it's very difficult to be in an intimate relationship with them. It's very difficult to be boyfriend, girlfriend, or partner in any way to them. Social isolation, of course, is a big one. If you don't have many opportunities to be out, you're mostly in your room, you're mostly by yourself, you aren't making those friendships and those other relationships that are needed. Sensory processing differences is a big one, and it can look like anything. Certainly sensitivity to touch and aversion to certain kinds of touch is major, and that's kind of the first one people tend to think about when we talk about sensory processing and how it might affect sexual and intimate relationships. But honestly, all of the sensory processing differences can have a role. Another, I think, very significant one is sensitivity to sound. Kissing has sounds. There are sounds that come up when you're dating someone, and there are smells, there are all of it. So the sensory processing differences can play a really significant role, more than people often realize. And then sexual frustration. There's really a question about what is the role of sexual frustration? It certainly can impact behavior and can impact interactions. And if a person doesn't understand their sexuality and doesn't recognize what sexual frustration is, it could be playing a really major role in their behavior without them understanding and being able to accommodate for it. I'm going to go on to the family here for a second. So sometimes a family's culture and the individual's beliefs and values and identity can be at odds with each other. Of course, our kids are not exactly like us. And so, of course, that can create some conflict and difficulty. But there's other things that can certainly be happening. So parents may have their own sexual or relationship trauma. They may have psychiatric illness, and that can show up in ways that makes it difficult for them to teach and model appropriate behaviors with their own child. Sometimes there's significant mistrust in relationships, and sometimes there's mistrust in that parent-child relationship. And so that can make it very, very difficult. And even like personality factors can really play in. So for instance, I'd like you to imagine maybe let's say a 14-year-old who has autism, is very private, very self-conscious, doesn't like direct attention, but he has a parent who is brazen, sexually expressive, wants to talk about this stuff all the time in very direct language. That's going to be a mismatch. It's probably going to shut that child down further, right, in that interaction. And sometimes you see the reverse. You can certainly see a child with autism who's pretty unfiltered with this stuff, and a parent who feels very embarrassed or cautious about it. So I think it's important to consider that match between parent and child when thinking about this stuff. I kind of alluded to it earlier, but I want to talk a bit more. Like, there could be significant discrepancies between the core values that parents hold and their children hold. And this might come up, for instance, if a parent has an expectation that their child will partner with, one person for their whole life who is cis, straight, opposite gendered person. And that might not be what fits what the child views for themselves down the road. And then society is, kind of taking yet another step back and looking at what are the things that can come up that could interfere with intimate relationships and dating. And one of the things that appears to be true in autism, there's a little research suggesting it, again, like a lot of things I've mentioned, not enough to have a solid research base, but there's some research that suggests that people with autism prefer to do one thing at a time. So really buckle down and get through school, and then move on to getting a job, and then move on to dating. So they go through sequentially because it's easier to focus on one thing at a time. Again, not true of the whole spectrum, but it seems to be truer of autistic people than typically developing people. So when you have a gap in adult services and there aren't job opportunities or housing opportunities or socialization options available, that can break down that plan, that can break down that system. Can certainly delay things and push it out or make it not possible altogether. There are lots of other things that we'll talk more about that happen at a societal level. One of them is internet content. Internet content and the ways that an autistic person interacts with it can give them very much the wrong idea about what to expect in relationships or how people get relationships or what happens, once people are paired off. And also naive consumption of media. So put a pin in that one. We're going to come back to that one and talk quite a bit. From a practical angle, I wanted to talk a little about the domains that are meant to be covered in sexual education. And this comes partially from Planned Parenthood, but from other sources where people have researched what's the complete body of information that kids need to make healthy choices in their future. And so human development, that includes things like reproduction, puberty, orientation, gender identity, and that kind of stuff. So the whole range of maturation and development are kind of included under there. Relationships includes families, friends, romantic relationships, dating, that kind of stuff. Personal skills. So this is communication, negotiation, decision-making, consent. Sexual behavior includes, abstinence as well as partnered and individual sexual activities and just what are the range of things that happen, not instruction on how to do those things, of course, but information about what those things are. Sexual health, and this includes sexually transmitted infections, contraception, pregnancy, all the health-related factors, medical health-related, not mental health. And then society and culture. So this is how do these aspects of gender and sexual diversity and sex in the media, how do these fit into the bigger picture and how do you fit into that? And what I find really encouraging about these domains and knowing that these are the domains that are now promoted for everyone, not just for autistic people, is how social they are. It really isn't just focused on the disease aspects and the pregnancy aspects anymore. There really is an increased focus on the social skills and the responsibility that really is inherent in these kinds of relationships. So it's important, of course, in any sexuality education to kind of cover all of these domains. And I think it's important in particular to kind of keep the themes of safety, responsibility, diversity, and pleasure in mind, because sometimes any one of these things can get dropped very easily. And they're key components for kind of making sure that you've been comprehensive with sex ed. But how do you adapt then for autistic people? Well, there's a range of specialized curricula out there. And it can be difficult to tell, though, who really knows autism and do they also know sexuality? Because what I've found, and it's getting better, but what I found in the early days was you've got a lot of experts in sex ed who are really great at it, but they don't know anything about autism. And they've got a lot of people who know autism really well, but they don't know the sex ed world. And so it's kind of difficult sometimes to bring all of that together because it's two very different worlds that just haven't really merged as well as they need to. And then the other tricky aspect, of course, is one size doesn't fit all. If you've got something that works for one student with autism, there's no guarantee that it's going to be the right thing for everybody. This says general strategies for the teacher, but I want you to keep in mind this is for clinicians, this is for parents, this can really apply for anyone. But the first recommendation is really to just try to get comfortable, whatever it takes to feel like you're comfortable with the language you're using, you're relaxed, and you can do this conversation. You may be very upset inside, but what you want to convey is openness and willingness to communicate. It's important to think about the individual's communication style. Is it somebody who can take on and is willing to handle a lot of verbal information? Is it somebody who would do better with something very visual and broken down and clear? Like how do you need to present the information? Make materials available refers to sometimes there are kids who just don't want to learn this stuff in an interaction with an adult. It's too uncomfortable for them. It just doesn't work for them. And for those students, if they can read, making books available, making simple videos available, making websites available is a great idea. And typically, you're not going to want just one form of any of this for anybody. You're going to want to do a combination of a few of these things. And I highly recommend using video and websites, especially to back up information for those kids who get really anxious and nervous about these conversations, because typically if they're really anxious, they just haven't been able to take on board everything that you want to share with them. I think it's important to remember that it's a marathon and not a sprint. I'm based in Chicago, so I went ahead and squeezed in a little shout out to Chicago there. This is not one conversation, it's ongoing conversation, repeated conversations. And it's really important to do it in a way that seems open. If you go in and kind of tell a child, this is what is expected of you, this is how it has to be, they're going to be less willing to talk to you and have that conversation. Now, of course, there are going to be some things that are set in stone and aren't flexible. And I'm not saying you can't have rules, but I'm saying when these conversations are introduced, it's very important to be as open and listen and to use your empathic skills as best you can. And of course, you want to be concrete and clear. So some general strategies, and then I have some pictures to show you of examples. I think it's really important to think of all the sex ed you present as having facts, and then also what are the concrete limits. So a fact is something like, here's a definition of masturbation. But what's the limit? Well, the limit is that something that you do in private, it's something that, whatever the limits need to be around that. I like using the word limit rather than boundary or rule, because a limit is something that a person sets for him or her or their self that they decide what happens. If you say a boundary, well, other people can push through your boundary. If you say rule, what if I don't feel like following that rule? I know it's semantics, but that word limit, I think, is really helpful. And when you explain that it's the limit you set, it also gives some power back to the individual. And then, of course, you want to teach the whys. Like, why does this rule matter? Why is this important? Why is this a fact that you're being told? We all know autistic people who really need that why before they can take the information on board and use it, right? Okay. Some of you have probably seen visuals like this before. I got this from Stephen Shore, who's an autistic adult and a professor and a self-advocate and just a super fantastic guy. But he uses it when he talks about how to teach the level of relationship. And I'm sure a lot of you have seen the concentric circles version of this that does the same thing. I have found going through this or something similar to this essential for every person I've ever worked with. You really can't assume that some of these distinctions are clear. I have patients who are graduate students at the University of Chicago, and we do some version of this. It's more complicated, it's more complex, but it's still really important to delineate the types of relationships. So sometimes when I look at visual supports, I get confused. Like sometimes I feel like they're put together in a way that just doesn't make sense to anybody. So I do want to say, I think it's really important when you're putting things together to make sure that it's comprehensible. You might have all the information you want there, but does it hang together and really make sense? I didn't put this up here just to make fun of Autism Speaks Canada. I'm going to come back to this, and I think it is really useful. But I put it up here because if this were meant to be, a social story or something, it doesn't make sense. It doesn't look like any kind of sequence, but I'll talk in a minute about how I would like to see it used. This is an example of a visual support that I used to reinforce some of the concepts that we talked about. Oops, I went the wrong way. There we go. Some of the concepts we talked about here. So what I did is I made a sheet that had different relationships at the top. So this is a girlfriend. This is your mom. This is your teacher. And then we took sticky notes and the person with autism matched them to the right relationship. So that was a good way to practice and get a sense of whether they were really taking that information on board. That relates back here, because I think if you were to take private, bedroom, bathroom, and kind of put that together, and then put public, school, with your parents, with your siblings, and have that over here, you could take some of these pictures of things like scratching your behind, touching your privates, whatever, and match them up to where it is okay to do it and where it isn't. So that's a way you can adapt something that's more verbally based to something that's more visual. This is another example, which is probably hard for you to see, but the top paper lists my name and the name of another clinician. Down at the bottom, the paper says mom, dad, or brother. And then on the right, it says sex ed website. So what we did with this is there was this an individual who kept asking questions of people to whom it was inappropriate to ask those questions. And so what we did here was we practiced. Where can you go with each question? Which questions can go to your parents? Which questions can go to the sex ed website that we bookmarked? And then which one can come to me or to the other clinician? Okay. Now I want to spend a little time talking about media and how media can impact people on the spectrum. Use of images and video can be really powerful interventions, like video modeling, for example, is really powerful and useful intervention. And sometimes people with autism are prone to emulate TV and films. And so if they have a real lack of information about sexuality and relationships and what they should be doing, they might revert to video and things they've seen on YouTube or in movies, right? But they also, if somebody isn't talking to them and kind of adjusting their ideas, they might think that what they see depicted in media is accurate. And this is how relationships really are. And that actually is not ordinarily the case. Sorry, just want to leave the section for 1 second. I realized that my cues aren't coming through. Like, so in terms of my
You're doing great.
Yeah, but the thing that's not coming through is when I have my screen on, I can't see your timing issue. So can you just remind me what time you want me to switch to the Q&A?
Yeah, Q&A starts at 11:15.
Thank you, I appreciate it.
You've got 10 minutes.
Perfect, okay. Thanks, everybody. Go. We'll get back to this. Thanks for your patience, everybody, as I go back to my presenter view here. And then I share it. Perfect, okay. So what's important with thinking about media is knowing that, first off, the initial porn exposure is typically accidental. So what happens is somebody is searching online and something just pops up. I always give the example, this happened to me when I was doing some research and I was trying to look out whitehouse.gov, but I accidentally put in whitehouse.com. And this is years ago, like George W. Bush was president. And it took me to porn. So it was just shocking. But that kind of thing happens. And there's some research to suggest that the average age of first exposure like that is around 11. You can imagine though, it's difficult to collect this information. It's difficult to do research on these kinds of things. So this was based on like internet records in the UK. So who knows how accurate that is, but that's very early. Anytime, before 15 or so, it's very early to get exposed to information if you're not going looking for it, if you're not ready for it. And so I think it's really important, and we'll talk later, that safe searches are really important for children so that they're not accidentally encountering this information. But if they do encounter it, it's important for parents to have a conversation with them about what it is and what it means. The other thing that I hear presenters talk a lot about is the difference in the type of content that people come across now. When I was a child, like back in the 80s and early 90s, if we found something accidentally, it was somebody's old Playboy. It was some, maybe pictures of a naked person, but it typically wasn't incredibly graphic. And I think part of the difficulty now is if kids are accidentally coming across information online, it might be much more graphic and much more difficult to make sense of. And depending upon the developmental level of the person, could be pretty upsetting. So I have a slide here I don't want to spend too much time on, but the slide is talking about the American Academy of Pediatrics guidelines for scaffolding and scaffolding screen time. And I think it's important to bring up just because we don't have great guidelines for how do you scaffold use of media? How do you keep an eye on what people are doing once they're 6 and over? So I suggest that professionals work with families to consider the developmental level of the child, to think about the child's past experiences, and to really develop a clear plan. It's tricky, but important to weigh out potential benefits of using technology with the risks. And I don't want to demonize media and technology. I think there's some substantial social benefits that can come from social engagement online. So I'm not saying it's bad across the board, but I would encourage anyone working with families to help them kind of think through a concrete plan that goes all the way up to the point that the person's ready to be completely independent with their use of it. I find this visual really helpful for thinking about internet safety and how to teach it. So really, internet safety comes at the intersection of a person being able to regulate their behavior and some knowledge about how to avoid and manage risks and some skill at doing that. So, you only get internet safety if you have both of those things. A person with very limited or no behavior regulation is going to be a real risk online, right? As is somebody who might be pretty well regulated, but knows nothing about the risks. Same graphic, but what I've inserted is what needs to happen to kind of fill it in and promote safety. And on one side, I think that scaffolding and those parental controls and supports and oversight are helpful. And then on the other side, for avoiding and managing the risk piece, I think education is really important. And the goal of all of it is to just shed some light on some of these dark corners of the internet where people might find themselves, but not fully appreciate what they're seeing, why they're seeing it. So shedding the light, I think, is extremely important. I have a few slides that I like to use to talk about how media that isn't even pornography, just general media, can be confusing. What I have here is a few examples of neoteny. So that's the idea of childlike features on someone who otherwise has adult or secondary sex characteristics. So you see with the humans here, you see very childlike eyes, the facial characteristics are very childlike. They're like a toddler, right? Whereas the body is more developed. So these are images that come up, I use Betty Boop, of course, is an old time cartoon character, but we see the anime up in this corner, and then we see a video game character on the other side. The video game character, I'm forgetting her age now, but she's between 12 and 14. So what's very confusing here for people who might have a social disability is, who is it okay to see in a sexual way and who is it not okay to see in a sexual way, right? There's a lot of information presented in these images that runs counter to what our societal norms are. I also have this picture of the pony, because that's a very sexualized, provocative image of a pony that most people wouldn't see that as an appropriate target for sexual interest. And so that can be confusing. I'm not saying these things are all inherently bad, anything like that, but I'm saying they could be really confusing for a person on the spectrum. And they also suggest that it's okay to sexualize somebody who's really young, at least in this case example of the video game character. The other thing I like to talk about with media is the idea that mixed messages and very confusing messages can come out of films. And we all know somebody on the spectrum who is interested in a Disney movie or is really obsessed with like 90s movies or something, right? And there are problems with the way that relationships are portrayed in these movies. Here, I just pulled up a few examples of times where consent is a little sketchy, or perhaps there's some stalking going on, like in the case of John Cusack here, right? He's persisting and persisting after the woman has said she doesn't want a relationship anymore. It's portrayed often as romantic to do these things and to be over the top and to have these, massive gestures. And I'm not saying these movies are bad or there's anything inherently wrong with them, but I do think they need to come along with a conversation with the child about, what does this really mean? How does it relate to what happens in real life and how we should behave with other people in real life? I like this image. It's kind of a mess, but what I like to think of this as is a way of thinking about what can come from the internet and what people need to know about pornography and sexuality, the way it's portrayed on the internet. So certainly the most important thing to highlight is what you see isn't a model for how you should behave. Unless you're looking at a really great, helpful YouTube from an adult with autism telling other autistic adults, here are some great dating tips, probably you don't want to model yourself after what you're seeing online. So how do you discuss it? If you are watching pornography or you're viewing even just shows about relationships, how is it okay to use that information? I think it's important to explain that bodies and minds may work very differently. So just because, for instance, you found it exciting to look at a certain picture, it doesn't mean that that's how you necessarily identify. It could be that, you are already worked up in a moment and you happen to see something, but it doesn't need to necessarily map on in that way. And especially for young women, it's important that they learn that disconnect, that sometimes your bodies just don't react in the way that that's consistent with what's in your mind and what you really want. Legality is important to talk about. I mentioned earlier that I've been involved in a lot of criminal cases, and I've been surprised by how naive people often are about what's allowed and legal versus what isn't. I'm not going to go through all these others, but they basically, I think body image is evident. Kabuki and some of the others refer to the idea that pornography and relationships depicted in media are often just performative and that they don't really map onto the way things actually work, as we talked about earlier. I have a lot of resources in my slides here. I would encourage you, to take a look at all of these different sites. I think there's a lot of good stuff here to offer. I want to point out a lot of them are autism specific, but Scarlet Teen isn't. That's a website run kind of by and for teenagers that provides a lot of sexuality education information. it's often at a higher level than, most of my patients can access. And I have found it helpful just for like answering some of my own questions over time.